Good evening, everyone. Really excited to be here today. So SyncThink is working on the solution to what we believe is a very important problem. That for brain health and issues related to brain health, for the most part, the diagnostic metrics, the diagnostic techniques that are used are not objective. They're highly subjective. How do you feel? What does your gait look like? Do you experience certain symptoms? If you take a cognitive test, how does that compare to an earlier baseline that perhaps wasn't accurate? So unlike other parts of the body, other organ systems, the testing and metrics around brain health are not objective. And this is a huge problem because there's an explosion in concern and actual numbers of people who are suffering from these conditions. So over 3 million people were diagnosed with concussion in the emergency room, millions of visits, 6.4 million children diagnosed with ADHD in the last year. And it was pretty interesting. The New York Times just had an article that said that if you're born in August, you have twice the likelihood of being diagnosed with ADHD. Clearly, we're not using objective metrics. So SyncThink has built a solution to this. We use a VR-based device, and it essentially is measuring your ability to predict. We use eye tracking to have people follow a visual signal, and we record their response. The whole test takes under 60 seconds. The product was developed through a partnership with the military over a number of years. Over $36 million of grant funding was put into the company after the Iraq War, when there was a big concern about diagnosing concussions. So the same concern that we're seeing right now in sports has been going on in the military for a number of years, and SyncThink was given the challenge to help solve this. And we did this using eye tracking technology and VR. Our science is supported by over 30 peer-reviewed publications. We have 12 issued patents and FDA clearance. An example of the test results is here. We are measuring the patient's ability to follow a predictable stimulus. A light going in a circle is something that we can all predict, and we actually measure how well you do that. And what you see here in the top chart is on the left, a patient with excellent eye tracking. They're very healthy. And on the right, actually, this is that same person suffering from fatigue. As part of our military research, we actually sleep-deprived soldiers, and we can measure objectively fatigue levels. Below is another soldier. You see on the left that same soldier's eye tracking when they're healthy, and to the right, a pretty dramatic example of how they are impaired when they suffer from a concussion. And in this case, the concussion signal, which is unique from fatigue, which is unique from other brain health conditions, shows someone with a big timing error. We've, over the last year, expanded our product platform to include multiple assessments, so not just visual, but also balance. And then we've also provided recovery and performance optimization tools. As you can imagine, if you're diagnosed with a condition, the next question you have is, well, what can I do about it? And so we're now providing well-established modalities that vestibular therapists and vision therapists use to help people recover and actually improve on their brain health performance. We have over 30 customers using the platform. About 2/3 of them are sports customers, the Pac-12, the Golden State Warriors, the Atlanta Hawks, Georgia Tech, as well as a number of other schools, and major clinical partners such as Mass General, Stanford, Previa Clinic are all successfully using the platform, and they're using it a lot. And in recent months, we've had over 5,000 tests conducted on the platform. And then this growth in customers has been reflected in a pretty dramatic rise in our monthly growth lately. We're addressing a big market. Right now, we're actively involved in really the brain injury and impairment market, as well as performance and fatigue. And those are large markets. But we view this as a broad horizontal platform where we can measure objectively a number of brain health conditions. And some of those markets are even larger still, such as Alzheimer's, child development, ADHD. We're right now raising a Series A to help us expand our go-to-market, sales and marketing, as well as research on additional indications. Thank you.